All right. We'd like to thank everyone for getting on board today. Today's topic, um, this is the Loving Heart Youth Services staff training for behavioral health program. And today we're going to talk a little bit about the client intake process. And so we have on today's call, our trainer today is Miss Kenyatta and Kaiser. And Miss Kenyatta has extensive experience in this area and working within the behavioral health field. Ms. Kenyatta, you want to just maybe take a couple of minutes and talk a little bit about yourself and your background?
I've worked in healthcare finance for 20 years now, and I've been doing behavioral health for the last 8 years, mostly as a consultant. And now I'm actually doing, well, I had a pilot program before. So now I have this program is my own program that I'm managing, facilitating, and doing everything. So under the consultant piece, I was really just doing program development, so writing programs for organizations, billing, credentialing, compliance, and doing their auditing too. So I did a lot of professional development pieces as well.
Great. So what we're going to do is I'm going to share my screen. We're going to go through the client intake packet. And if you could just kind of, again, just walk us through that process, and we kind of take it from there. Can you see, can you see my screen?
Yes.
All right.
So that the first page is the intake checklist. This is really for you to verify that all the documents are completed. So there is listed on their intake and referral screening form, client handbook, client handbook acknowledgement form, consent for treatment. Here's my turn important informed consent, cost sharing fee agreement, provider service overview, confidentiality statement, transportation statement. The 42 CRF is for our SUD clients only. Under this program, y'all will not be doing that. So, um, then authorization to disclose information, then the inter office intra agency form referral form. That's not for the client. That doesn't go to them. The voter's registration, if they're not registered voter, if you want, you could complete that. But it's not required. The client resource assessment tools, you guys don't have to worry about that either. That's something our LSW will do. The personal documents, we do need to make sure that we get a photo ID. If they're a minor, the adult's photo ID and a copy of the actual um client's insurance card.
Mhm.
The PNM insurance verification, that's on us to do. So you wouldn't be doing that. The intake assessment would be for our LSW to complete. So they would write if they completed the assessment and the treatment plan. The ASAM level of care for is only for the SUD, so that won't apply to this program.
Okay.
Now, discharge and termination, you're just intaking a client, so you wouldn't even be worried about this. But this is only used when the client is actually discharged from the program.
Okay.
So you would put the that they signed off on a termination form, whether they did or didn't, and but just giving them some type of informed information that they're discharged. Then the client resource assessment tools is also for if when they're discharged. So say if they're transitioning to a different program or doing like transitional housing, or they've completed programming all together, they or maybe they're not a good fit, you can give them resources
Okay.
um as you discharge them. This is the most important page, the intake referral screening form. So on this page, the staff is gonna write their name, the time, and the date. That's it. right there. Then they're gonna check whether it's urgent, routine, or emergent. You don't have to worry about the client ID. You're gonna select whether it's a adult or child or adolescent, right? Then the client is gonna fill out all the client information.
Now, I know we had talked about before, one of the things that we were thinking in terms of getting, having a way for our, uh, the staff to help the clients fill this paperwork out is to have a Zoom call and then have this PDF filler, and go over it with them. But do you have any other best practices in terms of, helping them fill out this form? Because we're looking at this form is maybe what, 28 pages, 29
But they're
pages.
not everything isn't something that they have to complete.
Okay,
So the only pages that they even have to complete is page 3, which is the intake referral screening form
okay,
that needs to be completed in its entirety. They don't fill out page 4 because that's for our office use only. They're gonna fill out the patient consent form. And so, this, like I said before, it's a non-medical medical environment. When you go to the doctor's office and they check you in, this is the same information that you get at your doctor's office.
okay.
You know that. They don't go over, they're not making sure that you read it. They give you the information so you can read and look over. But they just have you fill it out right there on the clipboard, right? And
Yes,
give it back to them. So it's the same concept. So I would have them just kind of tell them, if y'all are gonna go over it with them and help them to fill it out, you pretty much say like, when you get to the consent form, this is you giving us authorization to perform treatment.
okay,
When you're at the doctor's, you have to sign in a box or initial.
yes,
That's basically you're consenting for treatment, that you participate in the services. So here will be their name, date, signature, date. If it's an adult, they're gonna still put the client name and date as themselves, and then they'll sign and date it. Now, the staff signature is not something they have to worry about. Our staff is gonna sign there.
okay,
Now, they do have a right to refuse treatment. You can let them know that, but you don't want them to sign this. They're signing up for care. They're not refusing treatment.
exactly, okay. And then we have this next section with the, informed consent where they just initial for the electronic transmission of information. We talked about the mobile app. That is to provide the telehealth, is that correct?
Yes.
Okay,
But so with the mobile, hold on, let me go back down. It's just they're really just going over. That was weird. It popped up at the last minute that it's being recorded. Okay, so the electronic transmission is just, this is just the client consenting to get treatment all of these ways.
okay, got it, got it. I understand a variety of alternative methods of behavioral health care may be available to me, and that I may choose one or more of these at any time. My behavioral health care providers has explained the alternative to my satisfaction. Okay, got it.
Yeah, so it's just going over the different, but this is their responsibility to read this stuff and check off on it.
Yes.
And they do the same thing at your doctor's office. When you go, they're gonna let you read the information and you're gonna fill it out. So it's kind of the same thing. So just going over additional services, electronic presence, limitations, um, basically it kind of talks about, you know, regardless of the sophistication of today's technology, some information my practitioner would ordinarily get in-person therapy may be available in telehealth. So this more so just kind of talks about what the telehealth process could look like for them. And then the rest, I understand that telebehavioral health is a new deliverable method for professional services. And then the release of information. So they have to check off on all of this. Then discontinuing care, what that looks like, limits of confidentiality, alternative records. It kind of talks about records. We keep records. And then we also talk about the compensation. I understand that I am not entitled to any royalties or other forms of compensation for participating in any telebehavioral health therapy or other informed exchanges. So just letting them know that we're not going to pay them to participate in the program.
Gotcha. Okay.
Then contact information. They are going to receive a copy of the practitioner's contact information, their name, telephone number, voicemail, business email address, those types of things. Now, emergency care, that they acknowledge, however, that even if they're facing any emergency care, it could result in harm to them or any other person, that they're not seeking telebehavioral health for that. Instead, they're agreeing to seek immediate care, by contacting 911. Just our traditional practices of what you would do. You wouldn't call us in an emergency situation. You would contact somebody who could help you. So they would put their name and telephone number for any emergency contact people. So their emergency contacts would be any local physicians, a crisis line, a trusted friend or family. Um, everybody has people that they put in case of an emergency. Please call these people. So they have three people that they can put names and telephone numbers for. Then release of liability, just understanding that I unconditionally release and discharge Transformative Solutions LLC. It's an affiliate agent employee. Here's my turning point. It's affiliates, agents, and employees and practitioners and his or her designees from any liability in connection with my participation in remote therapy. And then it's like a final agreement. They will put their name and date, and then you as a clinician, you would sign off that you witnessed it, that they agreed to this. Now, consent for treating minors has to be filled out when there is a minor involved, but if not, you skip that part.
Now, for us, again, in a group home setting, let's look at the group home setting and a child care daycare setting. So in the group home setting, this above release is given on behalf of the child's name because the patient is a minor. And then the signature would have to be that of the caseworker or the group home worker.
So before I had asked, usually it's the person at the group home because they give you consent to get them treatment when you don't have to call them every time you take them to the doctor's office, do you? And ask, can I take them to the doctor's or can I take them to the dentist? You would actually take them to the doctor's or the dentist and you would fill out the paperwork.
Right. Okay. No, we wouldn't have to give. No, we just take them to the doctor.
Yeah, it's the same thing.
Okay.
So the cost sharing fee agreement just basically breaks down who's responsible for what if they're not able to, if they're self-pay. But in this situation, we're working with clients that are Medicaid only, or have a Medicaid managed healthcare plan. We don't really have to worry about this cost sharing because we can't bill them.
Okay.
So if you run into a situation where someone doesn't have insurance or adequate insurance, we have to pretty much, we're gonna be doing charity for them. And then it kind of gives like a breakdown. Every organization has to have like a schedule of what they would charge like for private pay. These are the rates. But that's not going to be a situation for us. So it would just be putting the client's name and the date and a signature and a date that y'all went over it. Now the confidentiality statement, they would put their name. Don't worry about the client number. We have that. And when we load them in the system, we'll put that there. And they just need to sign and date here. The authorization for transportation. They need to fill this out. Even if they refuse to authorize, they need to just put a check in that box instead of signing. Now, medical emergencies, just giving consent for you to get them treatment. So they would want to fill this out in the case of emergency if they're with you guys, and they need to get them to the doctors. This needs to be
Authorization of
filled.
transportation. Does that signature then, is that signature the caseworker signature, allowing us to transport the kids back and forth to for whoever from, I'm thinking that might be the caseworker's guardian.
But she keeps saying that you can
It,
sign off on this because the group home
you're
can sign up on this.
yes, they can. So this could be done at the group home staff. It don't have to be the case manager. I believe the best practice for them, because what we've been doing here is we'll shoot an email letting them know, like, hey, thanks for allowing them to participate in a behavioral health program.
But let me say this, Peterson, for our situation, it would be our vehicle. Kenyatta will not be transported now. Remember, because this is a template for them up there in Toledo. So these kids will be in our vehicle. But for example, our rule, Kenyatta, is that they have to be in a car with a staff member that's a Loving Heart, and they also have to have a car that's being vehicle checked that has that sticker in the window. So for the group home kids.
So what about the community outreach programs that are underneath the group homes?
No, they just have to be they can stay in any vehicle.
Okay.
So our form will say
It'll say creative corner.
okay.
Okay, got it.
So you guys don't have to fill out the SUD client form, which is that next that's that 42 CR F. Y'all wouldn't be filling that out at all.
Okay.
Now, authorization to disclose information, they can fill this out if they have somebody that they want to disclose information to. You might want to put like the case manager on here. So, because when they call and ask any questions about like progress, how they're doing, it may be their parole officer or somebody like that. So that's just a release of information, what we call a ROI,
Okay.
because we technically can't release any information about their care in the program to anybody without having this form on file.
Okay. Complaint and grievance procedure. That's all. Okay.
But we can skip over all the 42 CRF pieces because that doesn't apply. Now the next couple pages, well, it's more than a couple. These are just you giving the clients information about the program. So I will give them the patient rights, the grievance procedure, who they need to contact and everything.
Mm-hmm.
And then the service provider overview, client orientation overview. And then y'all don't have to give them they don't have to know about in their treatment plan. They don't have to, y'all don't have to give them the research evaluation pieces. You don't have to give them the breakdown of services. Y'all know the breakdown of services. So page if y'all want to, y'all can, but We don't give them this. That individual treatment plan page, the
Right,
counseling and therapy group page, um, service activities. That's really for us to kind of have a better idea of what the services look like. Now they do have to sign, put their name and date and sign on um an urgent evaluation of the following elements when clinically indicated. Just understanding what's happening, if they're in crisis, all of that. So this more so about speaks to crisis and what it looks like, their goals and a scope, and them just understanding when we have to have an urgent evaluation, what that looks like.
okay,
And now this here's my turning point intra agency referral form. Y'all don't have to fill out that. This not for y'all.
okay,
I mean, it's not for the client.
okay.
This is for in house, and really, I'm looking at this. This is what we would be filling out. Um, and the only thing that would be on here is after this is filled out, the case manager will sign and date on here. Our LSW, well, y'all have your own LSW, so the LSW will sign and date, and then our clinical director Celeste will sign and date here, and then that's it. So it's not they're not filling out as much as it seems because it's a lot of pages, but a lot of pages aren't required to actually be filled out. It's just more informative.
Okay. Because I thought would be, yeah, yeah, we'll do that. And then for the group home kids, getting as much as filled out as possible. So Patty, was that helpful in terms of you guys working through the forms and getting the basic information filled out on the child?